Welcome to the 4DMed Update. I'm Andy Zajac. On the program today, we update you on the latest incredible technology in virtual reality that will certainly have an amazing change in the medical field in the near future. Today, to discuss this topic, Dr. Neville Shimmin joins us once again. He is the director at 4DMed. Welcome back to the program.
Hi, Andy. It's nice to be back on the show.
Okay, let's get into this. What are the latest developments at 4DMed?
Thanks for asking, Andy. As you know, 4DMed is a medical training and simulation software company, and a simulation of a wide range of medical procedures for nurses, surgeons, ICU workers. Really, we're all about minimizing skill deficiency by enabling risk-free hands-on practice. So our user cases, we focused originally on surgery simulation. So a simulation of an operating room environment helps the surgeon gain practical skills and raise competency levels in a safe environment. But this pandemic has focused 4DMed at looking at crisis simulation as well. So simulation of rare emergencies, accidents with multiple cases, or in this case, rare disease outbreaks. This allows our medical experts to develop automatic response behavior to low frequency situations. We've also been looking at other scenarios like onboard, which is a simulation of a typical work environment for starting out medics. It helps them to faster adjust to the real world specifics and the environments, and eliminate some of the skill deficiencies in a risk-free condition. Of course, we continue with the use of medical equipment, which is where our content libraries work, and simulating operational professional medical equipment is complex and difficult. But the advantage is it minimizes training costs due to trainer-less guidance and lowers the learning curve. So 4DMed is continuing its development of a proprietary platform for medical training through VR simulation. But we want you to sort of think about this as, or it can be thought of as an innovative VR solution architecture. So the architecture of a VR solution for medical training comprises really of three elements: a client VR application. In our case, it could be a surgery, say, of a thoracotomy, or a procedure like a catheterization, which loads necessary data from a database web server, and a web administration panel manages the two components. So 4DMed's been focusing on content, but is beginning early development of 5 key modules related to the client VR application. Number one, the VR visualization module, which defines the logic of the VR world building by defining the physics and storing AI data for non-controllable VR characters. The patient AI, which is critical for onboarding and crisis simulations, and it helps to recreate real communication. And the instructor AI component is vital for guiding a surgery or assisting in medical equipment use and training. Number two is the replay and training analytics module, which automatically records the simulation and assesses a trainee's performance based on numerous metrics. It's possible to create a database for storing multiple recordings for the future replay, or only make the last simulation available for replay. Number three is the scenario editing module. This allows editing of existing scenarios stored in the database. Number four, the supplementary data load, which is an optional load of additional data that can be useful for the trainee during the simulation. Typically, that would be radiology information from, say, MRI or CT, or even other 3D models. And finally, number five, the scenario simulation system, which allows a user to interact with the scenario and its content. 4DMed's always kept in mind 3 important considerations when developing these VR tools. And the first is the limitations of VR's applicability to medical training. So despite the development of hepatic technology, it's not recommended to use VR for practicing procedures that rely on thorough palpation, for example, using your hands or fingers for identifying disease, or involving, delicate surgical drilling, since highly detailed surfaces and vibration feedback are hard to simulate. However, even with these limitations, the range of areas where VR training proves to be very effective is immense. Some of the positive elements of having a scalable software solution or simulation software solution is when you have a scalable VR solution architecture, it allows for cheaper and faster evolution of VR software. With all the assets stored independently from the client in the database, it is simple to expand your scenarios. You can say, add an instructor, user role, and modify an existing simulation. So not only the trainee, but also potentially say a trainer can enter the VR world. The other thing we bear in mind is VR simulation versus real life training. Ideally, VR-based and real life training should be combined. Yet it's hard to overestimate the importance of a risk-free environment that defines VR training, as well as its key possibilities of infinite task repetition. So far, practical studies show a high quality VR software can bring the same qualitative results as real-life simulations, and in addition, help reduce the training costs. For example, replacing mannequin-based training with VR training in learning to treat pulmonary diseases has brought about successful performance results and reduced costs by a factor of 3.
I understand there is a new educational tool for teaching clinical anatomy.
Yes, indeed, Andy. 4DMed is pleased to announce the development of a prototype interactive anatomy and physiology table, which simulates a human cadaver and provides virtual dissection. The 4DMed Anatomy Biotable is an advanced 3D anatomy visualization and virtual dissection tool of the digital body. The table is a high-resolution touchscreen in the shape of an operating table, which presents an interactive digital cadaver to medical students. An advanced 3D software model of the human anatomy, fully segmented by incorporating structural MRI data and functional anatomical data from contrast CT, creates the body for students to virtually dissect. Users can visualize anatomy exactly as they would on a fresh cadaver. Individual structures are reconstructed accurately in 3D, resulting in an unprecedented level of realistic anatomy, which is dissectable fully in 3D. Further iterations of the table will implement virtual reality through an appropriate headset to enhance visualization of anatomical structures and their orientation and function. To create a rich and unique anatomy content, 4DMed will create structures from the digital cadaver using the latest high-resolution digital radiography and anatomical databases. This content will be delivered to sites through a cloud-based server. 4DMed aims to offer 2 photorealistic cadavers, 78 regional anatomical cases, and hundreds of pathological examples. Thousands of structures will be segmented from radiological and photographic images to deliver accurate, real 3D anatomy from bones to nerve connections. So you will get an interactive segmentation, full annotations of anatomical structures, and modeling of physiology such as cardiac function. The table allows students to interact with young and well-preserved digital cadavers instead of aged and degenerated bodies. Students can also be exposed to different anatomical variations and a large number of pathological variations, enhancing their learning experience. The accurate details and rich content draw students' interest and attention, leading to more effective education outcomes.
What has been the impact of COVID-19 on international travel and conference attendance?
Unfortunately, Andy, it's been significant. We've, as a company, not been able to travel to all the major VR and AR events in the US and in Canada and in Europe. But we've taken part in a number of hybrid virtual reality conferences online. For example, NextTech AR, VR conferences, and we continue to have a strong presence online. So there's a number of conferences that are being put in place in the upcoming months in May, June, and July, and we'll be attending all those events online, representing the company and showing its capabilities and the technology that we're developing.
Do you have any update as to the latest developments in AR, VR space?
Indeed, Andy. Although the pandemic has been negative for many businesses, it's had a boom effect on the VR space, especially for hardware. A company, Facebook, which produces the Oculus Rift, has seen tremendous growth in that area, selling literally thousands of headsets, which has promoted the use of or VR, and also led developers to create a lot of new applications for its use. So this has really been a boom time, and we've seen a lot of new applications gamifying traditional workspace activities. So it's been a very positive development, and the price of hardware as well has also come down. And we've seen in recent months significant investment from institutional investors and sovereign wealth funds as well into hardware companies developing cutting edge 4K and 8K headsets. Pimax is a good example from China that's received over $50 million investment, and a number of other companies. So we can see that the VR space has absolutely taken off, and it's going to grow quickly. The technology maturity is advancing at a much faster pace, because even myself, I wouldn't be expecting 4K headsets as early as this year being norm. But the technology is rushing ahead, and I can see 4K developments occurring this year. This means that if you're in that simulation space, and for example, a medical student's wearing a headset, seeing such high resolution images really transforms the environment and gives the opportunity to be a totally immersive experience.
What trends do you see in 2021 for AR, VR, and more geared towards healthcare and education?
That's a great question, Andy. I can see that major institutions, healthcare institutions, and insurance companies are looking to see how they can apply this technology now to see some real benefits to both the training and the outcomes, patient outcomes, improving them, which has not been traditionally successful in all the Lean Six Sigma and other process improvements that they've tried to utilize over the years. But I can see VR really becoming a tool whereby training is fundamentally changed. And I can see healthcare institutions, even clinics and local GP practices using this technology to enhance the care and support for nurse training and for physician training.
Well, it's an amazing time to see such incredible advancements in technology. I'd like to once again thank you for returning to the show for an update.
Thank you, Andy. It's been a real pleasure to talk to you, and I look forward to updating you in the future.
And that's our show. Thanks for watching. I'm Andy Zajac. See you next time.